Maria Castaneda, first of all, thank you so much for your service as the highest ranking Asian American woman labor leader in the United States. And we honor you for being Pinay Power, especially this month of October, which is Filipino American History Month. And speaking of history, I guess my first question is about your history. Could you take us through your journey from the Philippines coming here and getting to the position where you're at now?
I migrated to the U.S. in 1984 and settled in New York City, where I initially volunteered for the Philippine Center for Immigrant Rights, an organization that assisted Filipinos with immigration issues. While networking among unions in New York, I met the political director of 1199, a healthcare union, where I was initially hired as an RN organizer. And for the last 36 years, I have been representing healthcare workers in hospitals, nursing home, and home care as Vice President and Executive Vice President, and currently as Secretary Treasurer.
And in your decades of experience doing this, working in the community, have you seen anything like the situation that we are finding ourselves in now?
We are in a life or death situation. The COVID-19 pandemic is still an uncontrolled public health crisis. I fear for the health and safety of our frontline healthcare workers and the vulnerable communities. The continuation of systemic racism and racial injustice is also like a virus that we need to address in order to save lives. We have to demand change in education and institutions like the justice system in order to progress as a truly united and equal opportunity country. The environmental crisis also cannot be ignored. As we see our communities burning and flooded by extreme weather patterns, we must act now to save our planet. The integrity of the democratic and electoral process is under attack. Voter suppression, voter roll purges, defunding of post offices are all tactics in making it difficult for people to fulfill their right to vote.
Now, talking about the pandemic is not possible without mention of our brave and hardworking Filipino medical frontliners. They sacrifice so much for their patients. What kinds of stories are you hearing from your members?
First, I want to salute and honor our fallen healthcare heroes. Many of them are Filipino nurses and other frontline healthcare workers. At the onset of the pandemic, our members described their hospitals as being like in a war zone, chaotic, very stressful, and frightening. From the first COVID-19 patients to the surge in the ER and ICUs, in just a few days, the entire hospital in New York City became COVID-designated facilities. All floors became ICU-type units. Our frontline members were not prepared for this crisis. There were no adequate training or orientation on how to work safely in those units. As they were fighting to save lives, they were also fighting to have the appropriate level of PPEs they needed to protect themselves. They were told to reuse their masks, no adequate supplies of N95. Members working in nursing homes struggled to even have the basic masks, gloves, and gown. Members had to fight for the universal standard of protection prevention. They continued to see CDC guidelines were downgraded due to lack of availability of PPE. Short staffing became an issue when staff started to get sick or needed to be quarantined. Childcare became an added hardship when schools were closed and remote learning had to be instituted at home.
In what ways do you think could the government have done better? Are they to blame?
The president has the moral burden for death of Americans and death of frontliners. The president should have followed the advice of the medical professionals and scientists and implemented a decisive and coordinated plans nationwide to stop the spread of the virus. He could invoke the defense production to mass produce PPEs and ventilators so that it can save frontliners' lives and patients. I salute the public heeding the call for wearing masks, social distancing, washing hands, no big gathering, no indoor dining, get tested, quarantining when not feeling well or being exposed to COVID-19. All this public cooperation helped New York flatten the curve. We need to stay vigilant, especially as we enter the fall and winter and the flu season.
That's why your group have come up with this PSA calling for people to use the power to vote. What would be your message?
My message is clear. Leadership matters. Election matters. We the people were able to flatten the curve of COVID-19. We the people can bring the much needed leadership in the country. Our lives matter. Our vote matter. Vote with us. Mga kababayan, bumoto tayo in honor of our fallen Filipino frontliners. Vote for change. Vote for our future. Vote for our lives. Wag na nating palampasin itong pagkakataon na to. We saw what happened in the last 4 years. This is the opportunity to make change. Nasa boto natin, nasa mga kamay natin. Wag natin sayangin ang ating oportunidad.
Filipino Americans are our nation's frontliners in this pandemic and are dying at an alarming rate.
I'm a public health nurse.
I'm a speech language pathology assistant.
I'm a home care worker.
I'm an emergency medicine physician.
Protektahan ang kalusugan ng ating pamilya at komunidad. Bumoto sa mga leaders na makikipaglaban sa ating kapakanan bilang Filipino Americans.
Boto mo, kinabukasan mo.
My vote is essential.
Vote with us.
SEIU Group is responsible for the content of this advertising.